Welcome to Conversations with Kay. I'm Kay Ryder. And every week I talk with Vermonters who are leaders in the fields of government, healthcare, education, the arts, and community life. And welcome to our radio listeners, 99.3 FM, WBVT LP. Our guest is Dr. Rick Page, and he is the Dean of the UVM Larner College of Medicine. Welcome.
Thank you very much, Kay.
Nice to have you here. Welcome to Vermont.
Thank you.
I'll give you the official public welcome here or something.
I appreciate that.
Why did you and your wife, Jeannie, want to come to Vermont?
Well, I grew up in Storrs, Connecticut, and Jeannie and I started our marriage actually in Massachusetts and have lived in various different places throughout my career, including Dallas, Seattle, and most recently Wisconsin. And about a couple of years ago now, I heard of the opportunity to lead the Larner College of Medicine, and it seemed like a great fit, personally and professionally. I was aware of the College of Medicine. I actually was friends with and worked with the chair of the Department of Medicine here, Polly Parsons, and I had been chair back in Wisconsin, so we'd interacted. So I was intrigued with the opportunity. Jeannie grew up in North Carolina, but had become accustomed to cold winters and was on board with the idea of coming. And then from the very beginning, it was clear this could be a wonderful fit for Jeannie and myself, both personally and professionally.
Well, Dean Page, now that you have been here for about a year, what do you like the best about Burlington?
Well, it's an amazing city. It's similar in some ways to Madison, smaller than Madison, bigger than the college town where I grew up, Storrs, Connecticut. It's got a great culture. It's got a great tradition. The state fits with Jeannie's and my perspective on the world, and the town itself is a wonderful collection of individuals who are here usually for a reason, and once they come here, they don't want to leave. I will mention also that Lake Champlain is gorgeous.
Oh, beautiful.
And Jeannie and I both sail. We have a sailboat that has moved from the Puget Sound to Lake Michigan and now Lake Champlain. And Jeannie tells me I'm most relaxed when I'm out on the boat, so when we can get away and spend time on the water, it's just spectacular.
Richard and I are mostly like that too. We are very relaxed, and it's much cheaper than a psychiatrist, isn't it?
Absolutely. Yep.
So you have been here, and you have been talking with people. You're on a learning curve. Who have you talked with, Dean Page?
Well, I've talked with people from throughout the university, the college, and the community. I am struck by the fact that this is a wonderfully, how shall I say it, compact state in terms of population, and various places I've lived, I might have met a senator or a representative. I've met both of our senators, our representative, various officials in town. When I first got here, I held a number of town halls to just listen, and my plan was to hear as many voices as possible, including students, both graduate and medical students, faculty, and staff. Our staff is amazing at the College of Medicine and the university in general. And I asked to hear everything from everybody that I could, and I really kind of vowed that I wouldn't undertake any major initiatives in my first few months. I broke that vow early on, and we may have a chance to talk about the professionalism statement that we wanted to generate. And what prompted my concentrating on that was a long tradition of my including a statement in every offer letter for faculty that I had recruited, for example. Mm-hmm. And as the new dean, in my very first week, I was signing offer letters, and for the first time in years, I didn't have a statement of core values of professionalism in my statement, in my letter. And that's why I charged a group early on to develop a statement that would be the Larner College of Medicine's commitment to professionalism.
Great. Well, we're going to talk about that statement, but I would like to ask you a sort of a personal question.
Sure.
Do you still do hands-on medicine yourself?
Matter of fact, I do. I'm a heart rhythm specialist. It's called clinical cardiac electrophysiology.
Ooh.
And it's a big doctor word for being I'm an internist, then a cardiologist, then an expert on heart rhythm disturbances. And I used to do invasive procedures, pacemakers, defibrillators, what's called ablation to cure actually heart rhythm disturbances. And I've always had a clinical practice where I saw patients in clinic.
That means
often.
going into the body. Invasive, yes.
Yes. But the non-invasive part, seeing patients in clinic with a problem and getting to know them, was something I was not willing to give up. So even though I don't do enough invasive procedures to keep a practice where I'm doing operations, I see patients every week in clinic. And I did it almost in a selfish way because I wasn't ready to stop being a doctor.
Good for you.
Most deans, and I can see why now, having done this for a while, have decided they really need to concentrate on being dean all of the time. But in addition to getting to know people that in a way that I never otherwise would. For example, as I was leaving Wisconsin, I said goodbye to dairy farmers and factory workers and people that wouldn't have necessarily had the sort of relationship that they had with me as their doctor. It was tough saying goodbye to them. But what I've enjoyed now, having a clinical practice, I see patients every Tuesday morning in the Tilly Clinic, is getting to know people in the community. And there are days where in the entire week, actually, I feel most comfortable in clinic. Because if you think about it, I've been taking care of patients for better than 30 years. And now I've been dean for 11 months, but felt a lot more comfortable in clinic than being dean in my first couple months.
Okay, well, I'm glad you do that. Our son, who's an orthopedic surgeon in California, one of his biggest clients, one of his biggest patients he had was a fireman. And he got the fireman back to work. And that was a marvelous thing for our son, Stephen. It was just wonderful. Now, I'm talking with Dean Rick Page, who's the dean of the UVM Larner College of Medicine. And we're talking about his career and his new role as a dean at the college. So, what is special about the Larner College of Medicine?
Well, there's so many things, but to highlight, it's the 7th oldest College of Medicine in the United States. It has a great tradition back to 1820. I feel honored to be the 18th dean of the College of Medicine, and it has a great tradition of serving Vermont, but also serving the region and frankly, the nation. There's always been a large rural population, and the commitment to rural health and primary care is something that is very special. There's been innovation in education going decades back, initially with the Vermont integrated curriculum, where students were exposed to patients much earlier than other medical schools were doing that. The traditional medical school was you'd go to lectures for 2 years and then suddenly you get to see your first patient. Our students were just welcomed a couple weeks ago, and actually they had their first patient interviewed as a group their first day of school. So they're seeing patients early on and getting that experience. In more recent years, we've become really well known internationally for a commitment to active learning. Now, active learning is the reverse of what I experienced. Medical school, starting in 1980, was very passive, where you went to lecture as a group and lecturers came in, and sometimes they were good and sometimes they weren't that good. And many students decided they could learn more from the book or the transcript or the tape and wouldn't even show up to class. Now, I felt, what the heck, I was going to go to class. If I was paying tuition to go, I was going to attend, and part of it was out of respect, but in point of fact, that's not the best way to learn. The better way to learn is to do some work in preparation and then have active sessions, working potentially as a team, trying to solve problems together, because that's preparation for what we're going to be doing the rest of our lives.
Right. I think that in the past, I think that like when my husband and my son, daughter-in-law, not quite so much, but the lecture was the big deal. Right. But as time went on, people had more hands-on experience earlier. Right. And I think that's really, you cannot learn everything, can you?
It's impossible. And especially today, if you don't become a lifelong learner, you can't be what you need to be for your patients. You know, back when I took my medical boards in medicine and cardiology, I took them in the last years of being grandfathered in, where you have boards forever. But even for those boards, you're expected to continue maintenance of certification. And for my electrophysiology board, for my heart rhythm board, I have to renew that every 10 years, and that's appropriate. You've got to be a lifelong learner. So what we should be teaching medical students during medical school is to understand that some of their learning has to be at home in advance of then taking that knowledge and working with others to come up with a diagnosis. And actually, it's been shown that the retention, when you learn and then use and do, is much better than going to class and then, as in my case, reviewing your notes right before the exam and cramming,
right,
and then taking the exam and then you pass that course. But the fact is, medicine changes. You've got to keep learning throughout your career.
Yeah, the modern medical scene is really very, very different. And I think that, as I understand the curriculum change, and I think it's great, I think it's absolutely wonderful, is that you learn this foundation of knowledge which you need to know in order to talk the language, if you will. Medicine, like everything else, has its own little language and levels of this and levels of that and whatever. And you need that language. And then you get together with colleagues and with other medical students. And by doing this, you share your knowledge. Right. Because not everybody can know everything. So if you work as a team, when you come into this area where you're taking care of patients and dealing with problems in the body or in the mind, you have this sense of accountability to one another.
Right.
You need to listen to one another, and I think that's a great ability to be able to do that, to listen, and you need to think differently.
Right. The thing is that difference is something that it takes a little while. It takes more than a little while. It's an evolution for all of us to go from the old lecture to the newer active learning sessions. I've been teaching about heart rhythm problems to medical students for 20 years at least, and I'm now redoing my classwork for 2 education sessions. I can't call them lectures because they're not lectures, where students are expected to actually review videos and learn about the heart rhythms before my class. So I'm not teaching them about the technical parts of those heart rhythms, but when they get together in class, they're going to be working together and solving problems with what they've learned as I give them unknown EKGs and clinical vignettes. And then they're going to work together and try to come up with the answer, even using an audience response clicker. And I'll see whether they're getting it or not, and then we'll go through an explanation of how this group might have come to a different answer and how to make a diagnosis and eventually treat a patient.
Great, great.
It's exciting.
I also I want to go back to your mission statement. Why are mission statements important?
Well, the one thing I'll emphasize is not calling this a mission statement, but calling this a statement on professionalism. We have a mission statement for the College of Medicine, which I couldn't recite for you, unfortunately.
I believe that.
But the statement on professionalism is an aspiration. It's saying it was designed really for a recruitment tool for me, in that I would explain to the individual I was recruiting, this is the environment we aspire to create for you, and these are the expectations we have of you if you decide to join us. And as I mentioned early on, I charged a committee that it was diverse and inclusive. It had staff, students, faculty, and gave them parameters of what I was looking for, and they came up with this statement. And this is the idea that I thought was very novel, was to put it on a card, Professionalism at the Larner College of Medicine. If I may, I'll tell you how it reads.
Certainly, that's great.
It states, our Larner College of Medicine community upholds the highest standards of professionalism as we follow our passion for lifelong learning and improvement. We demonstrate professionalism through integrity, accountability, compassion, altruism, and social responsibility. We honor the trust our society has placed in us as stewards of the art and science of medicine, relying on cultural humility, kindness, and respect to guide our daily interactions. We expect all members of our community to embrace these principles of professionalism as we strive to conduct and support patient care, research, and education that are second to none.
That's a great statement. It's a great professional promise.
It is.
I think that's the word for it probably. You're telling people that you believe in these things and you're going to conduct your medicine in that way, and that is the best that they can have.
Right. And it's an aspiration and an expectation that we will aspire to that.
Great.
And you know, when I developed this actually in my Department of Medicine back in Wisconsin, and the dean asked me to pitch this to the other chairs, and one of the chairs mentioned, I wish I'd had this to point out to someone who misbehaved, frankly, in that department.
Right.
And that's good that you have that, but again, I don't see it as a way to catch someone, but rather to say up front, this is what we care about, this is what we're providing for you, and this is what we expect of everyone in the Larner College of Medicine community.
I'm talking with Dr. Rick Page, and he is the Dean of the Larner College of Medicine at the University of Vermont. Do you believe that health care is a right?
Absolutely. In our country, every individual ought to be treated and cared for with kindness and respect and with the best medical treatment we can provide. Anything else would be unfair and inappropriate. We, as physicians, as healers, we have to provide care for everyone who's here, and not only provide the minimum care, but provide it in a respectful, culturally humble way. It's critically important. It's that foundation may not be shared by everybody. One of the things that I think is special about this community is I think it's shared pretty well in this community. But in terms of healthcare, just empirically, to have people without primary care going to the emergency room, that's more expensive.
Oh yeah.
For all of us. What's important and what the ACA provided, referred to as Obamacare, provided was primary care for everyone. And if we keep population healthy, then we avoid all of the other high-end, or many of the other high-end interventions, and the overall cost of public health will be less if we're providing for all. But aside from the cost analysis, it's just the right moral thing to do.
Well, I lobbied for home health, hospice, outreach, community services. So I couldn't agree with you more. But I'd like to go back to what you talked about. You mentioned cities and rural healthcare. And we in a state like Vermont, which is small, you can try to achieve this level of care for everyone. When you get out, I recently read an article, and I can't remember where I read it, but about a doctor in Montana. And she had just this huge area, this huge rural area to serve for psychiatric and healthcare, regular healthcare. And so how can you do this, Dr. Page?
It's hard, isn't it? We're fortunate to be part of the UVM Health Network, which includes a number of hospitals, 3 in Vermont and 3 in upstate New York, that are caring for a largely rural area. What we're looking to do through this network is maintain levels of quality and service and primary care to the population, both in the more urban areas, and I say more urban because Burlington is not a big city, but out to the rural areas. But you've got to be smart in how you care for patients. We have a limited number of doctors, a limited number of healthcare providers, and if someone's spending all day driving to do a clinic, that's not efficient use So we've got to use telemedicine. We've got to provide opportunities for people out where they are to deliver the right care at the right place, and then bring people to the larger hospitals when they need that kind of care. So it takes foresight. A great example is the hub and spoke model in terms of opiate care within the state of Vermont, which is providing a level of medical intervention for every Vermonter potentially within days, as compared with other states that have not invested in this way. And again, I think it's the right thing to do, and it's the smart thing to do.
Well, we're lucky in Vermont because we have a relatively small state. Well, it is a small state. Let's be honest about this, and we have this opportunity to really reach out quite rapidly.
Right.
But I think that other states like Oklahoma and Montana and places like that in the middle of the country, can they learn something from Australia and places like that where they've had this system for quite a while?
I wonder. In those larger states, I haven't had as much experience or thought as deeply about that. I will point out that while Wisconsin is very different in parts of the state, with Madison and certainly Milwaukee, you go to upstate Wisconsin, and it looks very much like the state of Vermont. And what I like to think is the lessons we learn here in our population, we can export to other areas that are more spread out and are able to provide, hopefully we can provide lessons for care of rural areas throughout the United States.
Let's talk about the cost of medicine and the cost of going to medical school. Many people graduate from medical colleges with huge loans.
Right.
And they want to specialize, they want to go someplace where they can earn a better living to pay back their loans. So they don't go into primary care necessarily. Can you comment on that?
Yeah, the medical education is too expensive. I wish it weren't. I think there are now 2 schools that have pretty much eliminated tuition. If you know anybody who can give me $500 million, we could make that happen in Vermont. The amazing thing to me is the number of people who still go into primary care even with the kind of debt that they have. I don't know the exact numbers, but it's in the couple $100,000 of debt that students have very often when they include their undergraduate and their medical degree. One thing that is fortunate is you can pay off those loans eventually, even working as a primary care physician. But indeed, it's easier to work off that kind of debt if one is in a more lucrative specialty. I think various programs that give payback for primary care and loan forgiveness, I'd love to see that more available for our physicians who go into primary care specialties, especially in rural areas.
Right. Now, money, you know, money is hard to raise. And especially, probably in the area of research, I've had a doctor of mine say that, and he does research up here, and he says it's hard to get these grants, you know, it's very difficult, and getting harder because the federal money is going away as we speak, probably. You must have some plans, though, right now, for the Larner College of Medicine, and, you know, what are you thinking of for the future? Dr. Page.
I've had friends who were deans before I became a dean tell me it's all about space and money. Those are the commodities. Frankly, for me, it's all about learning and research and education and clinical care. But the issues of the finances are under pressure. We have been fortunate in recent years that the NIH budget has not been cut, and that's been thanks to the legislature keeping it that way. But it's very competitive. You write a grant and you're lucky if your grant has a 15-20% chance of being funded. That being said, I'm very proud that the Larner College of Medicine brings in over $80 million annually, the majority from federal sources, and those are competitive grants. Those aren't gifts Those are competitive grants. But even that is not going to fund all the things we need to do. So for example, philanthropy, people deciding that they will be happier and more fulfilled when they give their money away to a worthy endeavor, such as the College of Medicine, such as whatever they are committed to in terms of healthcare and research.
Scholarships for medical students.
That makes
scholarships
such a difference.
for medical
Scholarships
students.
for medical students, both research and education, the opportunities are there. Some people want to put the money into scholarships for medical students. Some other people want to commit to pediatrics or oncology, cancer, or the like. We are very proud that Mark Nelson, the chair of the Department of Pharmacology at the Larner College of Medicine, was just the first ever Vermonter elected to the National Academy of Sciences.
Wow.
That's a huge deal. I brought our new president around to see his lab, and his lab is not a showcase for state-of-the-art scientific laboratory research. To the contrary. And he's done this despite that. But for us to take it to the next level, we're working to raise money for a medical research building that we're hoping will actually be funded and even have us break ground next year. But that will depend on further philanthropic donation to allow us to build that building.
Right. Well, you know, I think that you are going in the right direction. I think that thinking in terms of your mission, I think that the people in the state of Vermont are very fortunate to have you in the position you are in, because I'm a great believer in education, and I think the way someone is educated, it's like the ripples on the pond, you know. It just spreads and spreads and spreads, and you never know where it's going to end. I'm glad you came to Vermont. I wish you the very, very best, you and your wife, Jeannie, and I hope you'll come back to chat with me again sometime, and thank you for coming.
Thank you very much for having me. It'd be my pleasure to come back anytime.
Great, and thank you for joining us on Conversations with Kay.